So I'm going to be talking about running the STP in the private sector. So it probably won't affect a lot of people on this webinar, but it's always helpful to understand other people's activities and what they're doing. So next slide, please. So who are we and what do we do? So we're Care Fertility Group, and we provide fertility treatment to NHS and self-funding patients. We're a private healthcare provider, and we've always trained reproductive scientists even before the STP. We had lots of trainees that would come to us for the ACE certificate and ACE diploma, ACE being the professional body for embryologists. As a company, we are involved in lots of research and development, and they're really important values for us. So we want to have young scientists who are going to be able to push us and move us forward so that we can provide the best treatment possible for our patients. And the nice thing about reproductive science is that it's a very fast-growing field. So within the company, we have a development pathway for all of our specialisms, whether it's the clinical team and the consultants, whether it's the nursing team from healthcare assistants through to the nursing managers, and also for our scientists. There's a development pathway for everybody. So if I could have the next slide, please. So on the scientific side, we have lots of scientists who are involved in research and development. And our current work has been on looking at time-lapse imaging for embryos and applying artificial intelligence. So what does that mean? We use an incubator called the EmbryoScope, which means that it takes an image of the embryo every 15 minutes in 7 different planes, and then it compiles a video of the embryo development. We then use an AI algorithm to look at how that embryo divides and how that fits with known implantation embryos to give you a selection tool for embryos. If I could have the next slide, please. So how does running the STP in the private sector differ to the NHS? Well, we have different corporate values and behaviours, and whilst they're aligned, they are different to the NHS. So it's quite difficult because whenever you make an application, whenever you're trying to fill in a form, it always asks about reference to the NHS values and behaviours, and ours are different. So ours are about integrity, innovation, inclusiveness, caring, can-do, and knowledgeable. So as I say, they're aligned, but they are different. We also have balance sheet responsibilities because we are a business, and everything that we do has to be costed. We have to look at the direct costs, the indirect costs, how things are affected by what we're doing. And we have training costs, which are incurred by both the trainee and the trainer, because we need time to train people. We have to make allowances for that, and it must be covered within our budget. Although the salary and the uni fees are covered, the rotational learning, the project, and the professional development are all at a cost to us. We see each STP trainee as an investment. And I don't think that that's different to you, but for us, that investment is a little bit different. We also have a staffing calculator that we use to make sure that we're operating efficiently and effectively. And I'm not sure, because I don't work in the NHS, but I haven't come across any reference to that sort of calculation before. Next slide, please. We also have a workforce planning strategy for our future business security, and that tends to be what feeds into how we look at our STPs, where we're going to place them and who we're going to place them with, because we have 18 laboratories across the country. We've got a dedicated training and development department, and we're currently developing a level 4 healthcare scientist reproductive science program. We've already got our STP and HSST programs in place, but we're really wanting to expand into apprenticeships. But the problem that we have is that reproductive science seems to sit outside of any funding program. And that for us, the access to metapscoping is really difficult. I'm forever emailing people and they're always saying, no, sorry. Could I have the next slide, please? So we're very lucky because there is a curriculum for the STP in embryology. Next slide, please. And I thought it'd be interesting just to have a look at how long we've been involved in the STP training of students. So we started back in 2018 with 4 STP students. And at that point, Care was actually paying for those STP courses. And I can't remember what it was, but I think that we were paying something like $25,000 for each of our students to HEE. We were buying that service effectively. And it wasn't until 2020 when we had our COVID year and everything seemed to go a bit astray that we actually managed to get some Health Education England funding. And that was really because at the time there was lots of disarray, and I contacted the school and said, look, I can take a student if you've got an STP student for embryology, as I know that a lot of the NHS clinics aren't taking them. So that was our first foray into health education funding that year. But since then, as you can see, we've been very successful. 2024 is seeing us only place 3 students, but again, that's to do with a business need. We have currently got about 20 students across the group. Because we've acquired different groups, we've also got some students who are in NHS labs who haven't yet transitioned over to Care. Next slide, please. So we have both in-service and direct entry students. So both bring their advantages and disadvantages. The advantages of an in-service is that there's a definite career commitment. They know this is what they want to do. They've already had a year or so with us. They understand the pressures, because embryology does carry an awful lot of responsibility, and some people just can't take that responsibility. They know the company, they know our systems, and they're already contracted staff. The disadvantages are that we're drawing from an existing pool of staff, which means that whilst they have an expectation of a training experience, they challenge our processes less. So we don't learn as much, and we have to backfill the previous role that they were in. Next slide, please. The direct entry STPs give us a different type of feel. We've got new scientists experience the company. They question our SOPs and our existing policies much more because they're new to the business. It means that we've got additional staff in our teams. It gives us workforce protection going forward, and there's an external recruitment process. So we don't have to worry about the recruitment. But that in turn, if you look across to the disadvantages column, gives us a disadvantage too, because it means we can't choose someone who's got a team fit for us. It's an external recruitment process, and as you know, it's who you get. So also, there's very often no previous experience in reproductive science, and there doesn't seem to be the same commitment to training because they don't have an expectation of what reproductive science is, and often apply for things that they don't like when they get there. It is corporate. We have our corporates and behaviours, and we are a business. And again, for some scientists, that's not what they enjoy. And we have found that actually the career commitment sometimes isn't quite as strong as it is from our in-service STPs. Next slide, please. So how do we run training within our organisation? So we have a corporate training plan for STP, and then we customise it for each location. Because the training officers are different, the training opportunities will be different, we have a local plan. We get each of the year group together because for some years, we've got 6 or 7 STPs, and it's really good to see them together, working things out, looking at what they need. They do quite a lot of their rotational work in genetics and things that way. They're very cohesive. They can plan going to uni together, and we tend to rent a house for them so that they can build that bond. The rotations we have to do in-house because it can be quite difficult to get placements. We encourage a lot of sharing across the organisation so that whilst we have an STP in one location, we encourage them to go to another lab to work for at least 2 weeks a year so that they can see how the same thing is done but in a different environment with different people. Because we have a lot of people who've done STP previously, we've got mentors available, and we've got a lot of support HR resources. There's a lot of corporate training and expertise around the STP, and new training officers can refer to that. And we also build the training officer activity into part of our scientific development framework, encouraging them to use mentorships and leadership skills. And then they can put that into their level 3 leadership apprentice that we run. We run both level 3 and level 5 so that their skills are being expanded and developed as well. Next slide, please. So what does the future hold for our STPs? Well, what we want to see are graduates who are well trained and offer the whole sector promise of future leadership. I know that right back at the beginning when we started doing STP, and the change came from the ACE certificate to STP. One of the criticisms that was levelled was that the NHS did all the training and the private sector picked up the STPs and stole them away at the end of the course. But actually, we are very pleased to be able to say that we train an awful lot of embryology STPs. Across our group, as I say, we have about 20 at the moment, which for private healthcare providers quite a reasonable number. We have the expansion of other clinics into our group, and we then encourage them to take on STP students and expand that pool that can then go out to other groups, NHS, but at least we are training our scientists for the future. But what we're really looking for is to be able to develop a program which joins up from apprenticeship to HSST so that we can offer a development pathway for all our scientific staff.